Hi, my name is Amanda, and today I'm going to show you how any health insurance contact center can leverage Procedureflow to improve efficiency, reduce costs, and make your agents experts faster. Joe is a new employee and has just received an incoming call. He starts by greeting the customer. "Thanks for calling Circle of Life. My name is Joe. How can I help you today?" After he notes their reason for calling, he finds out they're an existing customer and he can start the verification process. It's very important to verify exactly who he's speaking with because the verification process is very different depending on who's calling. In this scenario, Joe learns he's speaking with a pharmacist, which classifies them as a services provider. When a pharmacist calls on behalf of a patient, they must provide a valid provider number. So Joe needs to locate the provider file and validate them as a services provider. Procedureflow will let him know important things to watch out for, like duplicate numbers in the search results. After he's confirmed the caller's name, phone number, and address, he can see that they're listed as an active provider, and the pharmacist tells Joe he's calling on behalf of a patient, so he can locate the insured file, and once he's verified the insured, Procedureflow provides him with critical information, such as what he's legally allowed and not allowed to say to the pharmacist. Joe can then go back to the main page and continue with the last part of the process. Because Joe's speaking with a pharmacist, he can click Pharmacy. He learns that the pharmacist is calling to see if his patient is covered for a specific drug under his insurance plan. Joe starts by running a drug coverage confirmation report, and Procedureflow lets him know when the report is finished running, he'll either receive a green status, meaning the patient is covered for the drug, or red, meaning they're not. Let's assume that the response status came back as green and the patient is covered. There are some specific response codes showing, and Joe needs to determine if any of these codes are noteworthy. Now, imagine a more experienced agent sees this and notices that the response codes are not up to date. Duplicate therapy has been downgraded and is now a response code that can be ignored. A senior agent can easily help fix this by editing the procedure, and they can move duplicate therapy from an important response code to one that can be ignored. He can then give his draft a title, submit the change to his manager for approval, and go back to work. The manager, Rhonda, will then receive a change notification and see that an agent has suggested a change to one of the processes. She can see a side-by-side comparison of what the process looked like before and after the change was made, and can decline or approve this change, which will then be rolled out live to the entire team. Then, Joe and his colleagues will also receive a change notification, letting them know that everyone can now work with the new updated version of the process. And that's Procedureflow. In health insurance, processes and systems can be complex, and for your team to be successful, the most complicated procedures must be simple and easy to follow. If you'd like to learn more about how Procedureflow can help with your unique business needs, contact us today.